Hello everyone and welcome to Module 6. Let's take a look at our objectives. And please have your book ready to follow along. Chapter 10, page 144. On this slide I just added the chapter and the page number. Please look at this figure as I read to you from Chapter 10 on page 144 what critical thinking is. It is the process of intentional, higher level thinking to define a client's problem. What's the purpose of critical thinking? You may ask. Well, critical thinking involves the difference of statements of facts, judgments, and opinions. So we are registered nurses because we critically think. We critically think so we can have the best outcome for our patient. Critical thinking is a bridge between information and action. It also requires the implementation of cognitive skills. There are also 10 habits of the mind, which is also called affective components, and 7 skills, which is called cognitive components. You can find those components in Chapter 10 on page 144. Now, since you've been looking at this graph for quite some time, we're going to start from the top and work our way clockwise. And this allows us to be a critical thinker. So for the top, first we want to develop a critical thinking character. Next, we want to take responsibility and seek out learning experiences. Then we want to gain interpersonal skills such as teamwork, resolving conflict, and being an advocate. And then we want to practice related technical skills. For example, using a computer, managing IVs, and so forth. This thinking model is called the O'Farrell-Leffer's 4-cycle critical thinking model. As we learn throughout nursing and how to better enhance our critical thinking, there are some attitudes that foster critical thinking. And here are some as I scroll through. I highlighted independence, fair-mindedness, insight into egocentricity. Also, intellectual humility, intellectual courage to challenge the status quo. I'm not asking you to remember any of these. I'm just letting you know what it is. Integrity, perseverance, confidence. These are all attitudes that foster critical thinking. And you can say, well, you know what? I have some of those already, which is a great thing to have. Curiosity. I'm going to go backwards just so you guys can go back on that. Confidence, perseverance, integrity. We all have integrity. Rituals, intellectual courage to challenge status quo. We have to do that. Intellectual humility, insight to egocentricity, fair-mindedness, and independence. Attitudes that foster critical thinking, you can read on your own, and it's on page 148. As we become more engaged in nursing, and as we can move through fundamentals, I would like for all of you to read this. It's on page 149, setting priorities and how it pertains to you, and how things are viewed in your eyesight as fundamental students, and how you will grow and look back and see how you have grown. As you provide care, these questions will help you. They're also located on page 150 in box 10-3. But look at the questions. They're very helpful. Look at the first one. What clinical data from the client's chart is relevant and must be recognized as significant to the nurse? Same thing as I was trying to tell you with the highlighter. Highlight the data that's important, that's relevant, so you can have your nursing diagnosis. Also, look at the questions to ask while providing care to the patient. Look at these. What nursing assessment needs to be initiated to identify if this complication develops? So if the patient has something going on, or if the what if could happen, what are the signs and symptoms of that? What would you do if the what if would happen for a particular patient and their diagnosis? Before we move on to concept mapping, I just want to encourage everyone, as you grow and as you learn and retain the knowledge and how you apply the knowledge, your critical thinking skills will grow as well. I don't want anyone to freak out about, oh my gosh, look at all this information we have to learn. Your critical thinking skills will play an important part in your nursing practice. Look at all the various types of concept maps. Wow. In order to complete the concept map, we need to look at assessment. Let's look at Chapter 11 on assessing. All of these key terms are very important. I want you to make sure you understand the nursing process, which we're going to go over, and then I want you to understand what objective data is, and also what subjective data is, and your symptoms. Okay, so we're going to go over, I want you to understand that all these terms are important, but I wanted to point out those terms so we can start reviewing. Subjective is what the patient says. Objective is what you see. Objective data. Let's do an overview of the nursing process. This is the nursing process. It's on page 155, and I really like this graph. So you can read this, and let's just go down. So the nursing process, what we're going to do, assess or assessing. Right here, you're collecting data. What is data? What the patient states, also vital signs are data, your lab values are data, results are data. Okay, so you are assessing, you're collecting data, organizing data, validating the data, you're documenting the data. Now you have your diagnosing. That's when you analyze your data, you identify the health problem. What nursing, NANDA, diagnosis could this patient have based on my assessment? So therefore you start formulating a nursing diagnosis for this patient based on your subjective and your objective data. Now let's start planning. Okay, so what do we want? What is our goal? What is our goal for this patient? What is the goal? So you might see planning. What is your goal? How are you going to prioritize your problem? Okay, formulate goals, desired outcomes, select nursing interventions, write nursing interventions. Okay, so what is your goal? By the end of the shift, you want your patient pain to be to decrease from a 10 out of 10 to a 4 out of a 10. That's your goal. Sometimes we can't meet our goal, but that's the goal. Now, implementation, when you start reassessing, determine the nurse's need for assistance, implement the nursing interventions. What are you going to do about it? Supervise or delegate care, document nursing activities, implementation. And then of course you're going to you're going to evaluate everything that you did. Your teaching, was your teaching good? Were you able to complete all of your interventions? Was your goal met? Evaluate. Please read the scenario because it does. Whoever is having a tough time understanding, this gives you really these small paragraphs based on a scenario gives you a good idea of assessing, diagnosing, oh my goodness, I'm sorry, assessing, diagnosing, planning, and of course, what's next? Implementing, and last but not least, is evaluating. I apologize for the screen going up high. We will learn how to input our information into a mini concept map to critical think on developing a nursing diagnosis and realizing how we can provide care for our patients. This is a chart I'm scrolling through, table 11-1, on the phase and description of assessing, diagnosing, planning, implementing, evaluating, okay? And then once we're done, guess what we're doing? We are critical thinking, right in the middle of critical thinking. Here is another model that I thought would be really helpful to look at. As you guys read this box and see who we follow behind for credit, I am so happy that the nursing diagnosis, the way it's set up, has changed. Yeah, excuse me. You have the human response pattern, and then look down here. It's all broken up for you. When I started, all of the NANDIS was just there, and you had to try to figure out how it was given. But this is broken up: self-perception, perception, cognition, activity, elimination. It's all broken up for you, which is very, very nice. Page 185. I just wanted to add with documentation, I didn't want it to forget about the electronic charting. So please read this, and as you guys see, as we go to different or various clinical sites, the electronic charting, the name of the program will change, but the documentation is almost fairly alike. Don't forget the golden rule: if it wasn't documented, it wasn't done. Here you see there are all types of documentation. Each facility uses different types of documentation, depending on where you work. Read this. See if you can work it out. Do you have questions? Here is the remaining of the SOAP. If some facilities use SOAP, some use SOAPier. So it just depends on the documentation from that particular facility. Here is another type of documentation. PI, Problem Intervention Evaluation. Important, skin assessment. The MAR, your fluid balance record, intake and output. We barely see cardixes, but what you will see is something called a snapshot. Please read these guidelines. Very helpful. Here are some more guidelines, and look at the very bottom. No pencil. Do not black it out. No white out. If you make an error, it's one line through the word error with your initials. As reported, as I pointed out, the various documentation systems, you can also read this little blurb on page 223 about the documentation systems. There are some great photos, as well as you guys have the Evolve to pick different patients to practice on charting in the electronic medical record as you learn from your simulation. But this is kind of what the electronic medical record look like. Besides that, there's another one here. So you'll be able to go inside your chart, if not be able to chart, at least view your patient's information. Don't forget your SBAR, and we'll speak more of that in clinical. This is a quick review of an SBAR. Please review Chapter 15 as we continue to talk about different types of charting. And come to class with your questions. Thank you, and I am right below 15 minutes. Page 237 also talks of given report.